How does pharmacodynamics work in basic pharmacology? Imagine a tiny key fitting perfectly into a lock. That's how drugs interact with your body's biological targets. Pharmacodynamics is all about understanding what happens after that key turns. It studies how drugs produce their effects on the body and the mechanisms behind those effects. When you take a medication, it travels through your body and reaches specific sites called receptors, enzymes, or ion channels. These are like locks that only certain keys, or drugs, can fit into. When a drug binds to a receptor, it can do different things. It might activate the receptor, which is called agonism, leading to a stimulating effect. Or it might block the receptor, preventing other substances from binding, which is known as antagonism. Sometimes, drugs partially activate receptors, giving a weaker effect called partial agonism. There are also drugs that bind and produce the opposite effect of an agonist, called inverse agonism. Besides these, drugs can replace natural substances, stabilize receptor activity, or cause chemical changes that are beneficial or harmful. Understanding how much drug is needed to produce a certain effect is key. This is where the dose-response relationship comes in. It shows how increasing the dose increases the effect, usually forming a curve that levels off at a point called maximum effect or Emax. The concentration of drug needed to produce half of this maximum effect is called the EC50, which tells us about the drug's potency. The steepness of the dose-response curve is measured by the Hill coefficient, indicating how sensitive the effect is to changes in drug levels. The timing of drug effects depends on how the drug works. Some drugs act immediately by directly binding to receptors or enzymes. Others take longer because they influence gene activity or other indirect pathways. In medical school, grasping pharmacodynamics helps you predict how drugs will work in patients. It guides you in choosing the right dose to get the best effect without causing harm. For example, knowing the EC50 and Emax helps determine doses that are effective but not toxic. Pharmacodynamics works closely with pharmacokinetics, which explains how the body absorbs, distributes, metabolizes, and eliminates drugs. Together, they help you understand how drug levels change over time and how those changes affect the body. In simple terms, pharmacodynamics explains how drugs produce their effects by interacting with targets, how the dose relates to the effect, and what influences how strong and long those effects last. This knowledge is fundamental for making smart choices in drug therapy and helping patients get better results safely.